And there are signs that travel has resumed in earnest, despite pleadings from the country's Centers for Disease Control and Prevention to stay put. Even though the cases around the world stand at over 237 million and deaths edge close to 5 million, the recommendation largely is that fully vaccinated individuals refrain from non-essential travel. But even at that, as more people get vaccinated and travel ticks upward, there are questions about how to prove inoculation, including the so-called vaccine passport. To put things into perspective on the viability and safety of international travels and the vaccines, joining us is Dr. Nsebasi Akanem. He's also a pharmacist, a public health practitioner. We'd like to thank you for joining us in the studio.
Thank you for having me.
I'd like to begin looking at the optic of international travel. Since countries started vaccinating their population, is it safe to travel?
Well, for those who have been vaccinated, to an extent it's safe to travel, but then traveling to some of those countries that are still hotspots is really not advisable, especially for non-essential activities. If it is something that is absolutely important, that is not something that can be done virtually, well, it might be permitted, but as much as possible, we are encouraging more people to engage in virtual activities. If you are going for probably a meeting, a conference or something, you can do that virtually, at least for now, particularly for those countries like Brazil, South Africa, Turkey, India, and the rest of them. It's important that we limit travel to just absolutely essential, functions or essential duties, so that we can help protect ourselves. Because, we keep saying that taking COVID-19 vaccine does not protect a person absolutely from getting infected. The only thing it can do is to reduce the chances of developing severe, symptoms or complications. So if one is fully vaccinated, it doesn't mean that you cannot get infected, and that's why we need to avoid anything that will increase our risk of, contracting the vaccine.
What's your take on the COVID-19 vaccination or COVID-19 passports?
Well, COVID-19 vaccination, yes, is an interesting thing, and as much as possible, I encourage countries that have had access to enough doses of COVID-19 vaccine to encourage their people. And one way they can do that is to ensure that people present their their COVID-19 vaccination cards. To an extent, it shows us that there's a lesser risk of transmitting the infection to other people who are susceptible. But for countries like the sub-Saharan Africa, that we know that access to vaccine has been quite poor. I mean, implementing such would be it would not be fair at all, because there are some people in Nigeria who would probably love to take the vaccine. But because of the supply side challenges, they may not have access to the vaccine. So if you want to enforce it now, the vaccine card or the vaccine certification, it might just be going overboard. So I think until we get to that point whereby we have access to enough doses of COVID-19 vaccine, we can then be sure that anyone that has not taken the vaccine just blatantly refuses to take the vaccine. But for now, we have not gotten to that point yet.
So you don't think we should have a sort of, or require vaccine certification in country, but for us traveling out?
For those traveling out, I think it's necessary, because globally it's becoming an acceptable norm that you have to provide that, and it is in line with global best practice. It's what is expected, because we, as much as possible, we don't want people to export or import new variant of the virus. So that's why it's necessary that people who are traveling outside Nigeria, endeavor to take the vaccine so that they can receive their cards. And that is why I want to also say here that people should desist from racketeering. I mean, going to pick up a vaccine card without taking the shot, you're not doing anybody any good. You're not doing yourself any good either. So you go, if you need to travel, and it's quite essential, go and receive the shot. It's available in all the primary healthcare center, even the one nearest to you. So you go there, take the shot, get the card, and then travel. But for those in Nigeria who may not be able to access the vaccine, perhaps due to the fact that we don't have enough doses, I just feel that we should probably ease on those ones. for now.
Only today in Wales, there is the NHS COVID passes, and they're now compulsory to attend big events or even go to the nightclub. So what's your take on having such a passport system for as little as going to restaurants to eat?
Okay. Well, I would say this for now. Because we have not gotten to that level where we can actually enforce. You see, when you're talking about enforcement in open places and places like nightclubs, like restaurants and all of that, then as much as possible, you have to ensure that there's vaccine for people who are interested in going there. But because we have not gone there, that's why we keep encouraging Nigerians to please avoid crowded places. Avoid places that would increase your risk. Since we may not, as a country, be able to enforce and ban people who have not taken the vaccine, we are encouraging as much people as possible, okay, please go take the vaccine for those who can access the vaccine. And those who cannot access the vaccine, please avoid these places. Public places, places that are overcrowded, places where there's no proper ventilation, please avoid those places. And then, in addition to that, still adhere to the public health measures. And that even applies to everybody. Whether you are vaccinated or not, you need to adhere to these public measures because you can actually get infected if you're exposed to the virus.
2 days ago, 137 cases. Just last night, 78 cases. It looks like the curve is coming down.
Yeah, definitely. It is. And I want us to, as much as possible, we should consolidate on what we have achieved so far. From my observation, going to the field, I've seen that more people are coming out to take the vaccine. And I want to encourage that. I don't believe in forcing people. I believe that we need to communicate more with the people. We need to educate people more about the efficacy of the vaccine, the need to take the vaccine, and of course the safety of the vaccine. And as much as possible, we need to be able to manage the infodemic nature of this pandemic. As much as possible, we need to let people know that some of the misconceptions they are listening to, they are hearing, is absolutely not true. For example, somebody says you want to turn to a goat, you want to turn to a cow. A vaccine vaccine itself does not last more than 6 months in the human body. What lasts more are the antibodies that have been developed against the vaccine. That is what could last for a lifetime. So people should disabuse their mind of any adverse effect about the vaccine. Yes, there may be some adverse effect, but I am saying this, that the vaccine is very safe.
All right.
So Nigerians should go out there, get the vaccine, receive their vaccine cards, and be ready to present that card whenever they travel or wherever it is necessary.
We appreciate your perspective on this issue. Thank you so much, Dr. Nsabasi Ekanem, public health practitioner and pharmacist. Thank you for joining us on the program.
Thank you for having me.
Well, still to come on the program, in Zamfara Estate, you see a civil society activist who is saying that the state needs more vaccines. Please stay with us.